All right, this is Heather Longoria, and I am here with Dr. Caitlin Sullivan today. And this is the I Am a New Therapist webinar WebEx series that I started because when I graduated in February, I realized I still had a ton of questions that were unanswered, even after 18 years of really good education. So I met Caitlin at a networking meeting, and we ended up sitting across from each other and got to talking and realized that she went to chiropractic school in my hometown of Davenport, and we actually ended up living there at the same time and then didn't meet until we were down here in Clearwater, Florida. So just an awesome, I love synchronicities. I think it's the universe telling us that we're on the right track. So I wanted to interview Caitlin because just to find out how you have built your practice and what's worked well for you and what hasn't worked well for you. And then you are a fellow fan of continuing education and you're always learning new and interesting stuff too. So I wanted to talk to you about that. So before we get started, anything else you want to share about your background or maybe tell people how you got interested in chiropractic care and got to be where you are today?
Sure. So I've always wanted to do something in healthcare from the time I was at a young age. I've just always liked helping people. And so I played softball most of my life through my senior year of high school, and I suffered my handful of injuries just from being an athlete.
Mm-hmm.
And so I found myself in the orthopedic office a few times and looking at all the posters and the models, when we were waiting for the doctor to come in, I was like, man, this is kind of cool. And so once I got into college, I had decided that I wanted to pursue the sports medicine route. And so I was initially pre-med, and when I reached my junior year, I was majoring in kinesiology, which is a fancy word for exercise science. And so I was going to use that to get into med school. But the further I got into that process, I was like, man, I don't know if I'm truly committed, to the medical profession that I want to go through applying to medical schools, because once you start that path, you are kind of locked in for the most part, I feel like.
Mm-hmm.
So I was just kind of getting a little bit of cold feet. I wasn't truly certain that that's what I wanted to do. So I actually decided to do a little bit of shadowing. My mom worked at a hospital at the time, and so I went in and shadowed her physical therapy department. I was able to go in and talk to a few of the orthopedists just to get a little bit of more information about their profession. And I wound up shadowing, an athletic trainer. I shadowed a strength and conditioning coach, and nothing was really clicking for me. And especially after I talked with the orthopedist, I was like, yeah, I don't think that's what I want to do after all. Mm-hmm. And so it was funny because my senior year in college, one of the courses that we could take for credit was to shadow a profession, a certain number of hours. I know. And so one of my classmates actually recommended to me, hey, so have you thought about shadowing a chiropractor? Because I had already gone through this laundry list of professions that I wasn't clicking with. Mm-hmm. And initially I was like, no, they just do neck and back stuff. I had never been to a chiropractor. And he goes, well, no, there are sports chiropractors. Did you know that? And I said, no. So I found a sports chiropractor in my area, called him up. He was super friendly. I asked if I could just come in and shadow, see what it was all about. And he was like, sure, come on in. And so after my first day of shadowing there, I was sold. I was like, this is so freaking cool. Like, this is what I want to do. Because since he had a sports-based practice, he did a lot of soft tissue work, a lot of corrective exercise. He did full body chiropractic, which is now what I do as well. And it was just so cool to see people walking in pain or walking in and, one of the most memorable ones that I saw was this kid, and he was a high school athlete. And he just went to bend over to touch his toes and had so much pain and trouble doing that. And Doc was like, okay, so, he had me help him. And he was like, all right, Caitlin, I'm going to have you help me. We're going to do some active release technique on the hamstrings and everything. And it was like a 5-minute treatment. And the guy stood up, the high school student stood up, and then he reached over and palmed the floor, like flawless. I'm like, what the heck? And so I grew up in that, Western, the Western model of medicine. Mm-hmm. Okay, well, when you're sick, you go to the doctor and you take this medicine and, you pop an Advil. Like, I had never seen, this style of treatment. So it was just so cool to me. So ever since then, I was like, I'm sold. I'm doing this 100%. So the only downside was that since I was a senior in college, I wasn't prepared to then go to chiropractic school. So I didn't have all my prerequisites done. And so I actually took just a little bit of time off between undergrad and chiro school, because I decided, you know what, let me give myself just a little bit more time, make sure that this is definitely what I want to do. And so I worked as a personal trainer for a couple years in downtown Chicago, which is very expensive to live there, and they paid horribly. So
bad combination.
Yeah, so after a few years of that, I was like, I'm going back to school. I need a career. And so I jumped into chiropractic school, and I've been practicing now for a few years. And I started my own business, or my own practice, a little less than 2 years ago.
Awesome. So what did you learn while you were starting your own practice? Like what were the pros and cons? And like, if you had to do it all over again, what would you do differently, or what would you do the same?
Yeah. So obviously I kind of had this vision of what it would be like to have my own practice. And of course, reality and, your visions don't go hand in hand at all. So I thought it was going to be not so hard getting new patients. I felt like I practiced in kind of a unique way, despite being in a super saturated market. And I thought people would just find me and all this stuff. And so I definitely had a very naive approach. So, because I started in a small space with my overhead being very low, which has its pros and cons as well. So, I mean, it's good to keep your expenses low when you're just starting out, but at the same time, I also had no exposure. So the con to that is that you need to get out there and go meet people and let people know that you're there. And so, I was also just kind of naive in starting my practice and thinking that, I don't want to go tell people about myself until I have my space, because what if people want to come in and then I have to be like, well, hold on, I can't see you for another couple months now. So sorry that you're having horrible sciatica right now, but wait a couple months and come see me.
Yeah.
So I had decided to not really do any marketing until I had my space. And in retrospect, I wish I hadn't done that, because it wasn't how I thought it would be at all. I was then telling people about my practice while I had my space, but it was still taking lots of time to try to get on my door. It was not instantaneous at all. And, and I would consider myself a little bit more of an introverted person. So just going out and talking to strangers and meeting all these random people, it just didn't really come naturally to me. So I kind of withheld from that a little bit longer than I should have. So in retrospect, I definitely would have joined a networking group sooner and gotten out and networked and met more people. And it's really awesome once you do get into the community, because you meet people, like Heather or other people that work similarly to you, or that can help complement your practice. And it's kind of fun, because then you get to brainstorm and collaborate with those people, and you build up your own little referral group of, oh, great, well, you're having trouble with some soft tissue stuff. Cool. So you should go see somebody that really focuses on that, because you need a lot more than what I can give you. So it also is a great tool for your patients or your clients as well, to have that network. So I definitely would have done that differently. And I would say it's a toss-up as to whether or not I would have still started with my small space. It's hard to say, I guess, because it was nice having the low overhead. But like I said, I also feel like I almost wasted a year, because I was in that space for a year. So I also almost feel like I wasted a year of getting, the exposure that I could have had a lot sooner.
And so, your original space, did you say it was like inside a building, so you didn't have like any outside signage? What was your original space like?
Yeah, so it was an executive suite. So it was in a six-story office building. It was about 140 square feet, so like a 10 by 14 foot room. So it was okay for what I needed. But like I said, nobody knew I was there. So unless you're really willing to get out into your community and to really hustle to get the word out, then you have to kind of weigh your options as to whether, okay, would I rather pay a little bit more money for a space that's very visible and also not have to deal with moving? Because the move itself, my table's very heavy. So the move itself was like, is this really worth it? So you kind of have to weigh your options a little bit. But another thing that I did it was, at the time, I didn't want to take out a business loan.
Mm-hmm.
So another reason that I chose the low overhead was so that way we could just use what savings we had to kind of dump into the business. And again, I had this vision of like, okay, we're going to use our money to start it up, and then I'll quickly be repaying us. It won't be a big deal. And it just really didn't work like that. Like I said, it really takes time. Especially since I'm not from the Tampa area, which is where I practice. So I'm truly just starting from scratch.
Yeah.
So in retrospect, I feel like I may have actually taken out a business loan. On one hand, I don't have the interest of paying that, but on the other hand, we really depleted our savings. And so it postponed our plans of, getting a house or buying a car and those things that could have been easily funded with our own money had we had a business loan. Mm-hmm. So I would say in retrospect, I may have gone the business loan route instead.
Did you
so
work
those are
with
a couple of things that I've learned.
Did you work with a business coach or anything when you were trying to figure out how to build your business and start it? Or did you just figure it out on your own?
Yeah, and that's a great point too, because in chiropractic school, which I'm sure is similar to massage school, we don't get any business courses really. So, which is funny because most chiropractors ultimately want to own their own practice. So it would make sense that they would throw those courses in, but for whatever reason they don't. So I didn't have a lot of business sense, and I actually did wind up working with a business coach. Mm-hmm. And so I would recommend working with a business coach. However, I would be picky about it. So the business coach that I started with is not the same business coach that I currently have. Mm-hmm. And I quickly realized after I signed a contract with him that he wasn't a good fit for me. So I was unfortunately locked into paying him monthly for a year because I had signed a contract even though I wasn't really getting the value that I thought I was going to get. Mm-hmm. So I would say do your research, ask for a business coach referral from people that you like and trust and other people in your industry, and just make sure it's a good fit for you. Most of them will do like a free consultation just to see if you can get the services that you're looking for from that person. So I recommend a business coach, but get the right one for you. Definitely.
That's advice I've heard from other people too that have gotten them, because they can be like mind-blowingly awesome or just like a money drain. So
yeah, for sure.
Yeah. Let's see. Okay. So I found that to be true too, that how difficult, like when you get done with school, school kind of indoctrinates into you like how special you are and how amazing the therapy is that you do. And you kind of like, you get the sensation that you're going to walk out of there and people are just going to be like, you know, coming to you in droves,
Yeah.
And then you're like, oh, I got 2 patients this week. Like, what's wrong with the universe?
Like
and especially like moving here from out of state, which a lot of Floridians, aren't local, but it's really tough to get your name out there and get people to come in. And I think I heard somewhere that it takes like, I don't know, 10 or 12 touches before somebody trusts you enough to come in and see you. Cause it's like, we're working on the bodies. So it's like, it's a very personal thing for people.
Absolutely. Absolutely.
Yeah. Let's see. So you've been practicing for a couple years now, and what continuing education have you done that you found really useful, or any continuing education you've done that you're like, I didn't really get that much out of it?
Yeah. So the ones that really stand out for me that I liked and use are going to be the RockTape courses. So I did just the taping courses, the 1 and the 2, and I actually did that while I was in chiropractic school. And I use that one quite a bit. I have not taken their other courses yet, but I want to. They do like the rock pods and the rock blades, and those look really awesome and would definitely incorporate well into my practice. So they're on my list, but I can't speak on them yet.
Yeah.
And then one that I actually just took this year that I found out about through another colleague of mine. She's a massage therapist in another state. And so it might be really helpful for massage therapists as well. It is called Reflexive Performance Reset, also known as RPR.
Okay.
And so I guess I would say it's a little bit more so geared toward the athletic population, but you can technically use it on anybody. So, because she doesn't have necessarily a sports-based clientele or anything like that, but she had told me about it. And it was a really awesome course. However, I admit that I haven't really incorporated a ton into my practice. but she loves it hand in hand with massage therapy.
Oh,
So
interesting.
it might be a great fit for massage therapists. And basically what it is you go through, in level 2, there's level 1 and level 2 as of right now. I guess they're still developing, like level 3 and level 4. But so I've taken both. And in level 2, you get into a little bit more of movement assessments. And then level 1 is just more so the straight up correction. And level 1, they actually offer online. So I actually did it online, their online course, and I did level 2 in person. So level 1 just goes through a lot of the corrections. And so I would say level 1 is a little bit cookie cutter. It just kind of gives you some go-tos about, if you want to, here's a reset for the diaphragm, here's a reset for the glute, here's a reset for the psoas. And so she was raving about it. She's like, I get amazing results and it doesn't take much time, And so, so I liked it. I'm not trying to knock it. I'm just saying for my practice, I haven't used it a ton. And that's probably because the continuing education that I've focused on the most is a different protocol called neurokinetic therapy. And that one for me just goes really well with chiropractic. So I've used that more so in my practice, but the RPR for therapists might be a good fit. So something to consider and look into. Basically the neurokinetic therapy, it was actually developed for physical therapists and chiropractors initially, but now it's open to massage therapists. It's open to personal trainers. They've even opened it up to like yoga therapists, or I'm not sure if yoga instructors can take it or if you have to be a yoga therapist. I'm not sure what the differentiation is there, but I use that a lot in my practice. So basically what it is neurokinetic therapy helps to reveal people's compensation patterns. And so we go through a series of muscle tests, and I'll usually hone in my muscle tests based on what the patient comes in with, like what they're complaining of. Because you can obviously muscle test everywhere throughout the body, but I like to kind of zone in on their area of complaint. And so you go through a series of muscle tests, and you can actually figure out with the protocols what muscles are overworking and what muscles are underworking. And so again, revealing that person's compensation pattern, what muscle is kind of shut off, or what we call neurologically inhibited, or what muscle is overworking, or what we call neurologically facilitated. And so it's very specific. And so once you have that information, you can release the overworking or the facilitated muscle, and that you'll usually do that by way of either stretching, or more commonly I'll do like a trigger point or a little bit of a soft tissue release. And then you'll follow that with an activation of the underworking muscle or the inhibited muscle. And so it's pretty awesome because you see instantaneous results. And so as a practitioner, you see a difference, and as the client or the patient, you absolutely see a difference. And then the patient will also get homework. So it's instantaneous in that you'll notice an immediate difference. However, like anything, you have to retrain that muscle memory pattern. So the patient or the client will get homework, and they'll have to do the correction that you did in the office. They'll have to do that at home to help ingrain the new muscle memory pattern. But it's really awesome because people don't realize how long their compensation patterns can be present for. I've had patients come in who they've had issues for 15 years, 20 years, 4 years, or it can also just be a matter of months. But obviously, the longer the compensation pattern has been present, the bigger deal it is, because then you start getting secondary compensations, tertiary compensations, based on those original compensation patterns. So that's kind of what it is. And I use it all the time in my practice because it goes really well hand in hand with chiropractic care, like I said. So usually the way that I'll describe it is chiropractic will address a lot of the structural components of things, kind of getting realigned. And then the neurokinetic therapy is going to address more so the software of the body. So how things are firing when you go to perform a certain movement. Okay, well, what muscles is the brain and the body recruiting to do those movements? Are they the ideal muscles, or are they compensatory muscles? Because over time, while compensations are good initially, over time, they're bad, because then it starts just creating all this dysfunction. So I use that one a lot in my practice, and it's definitely been my favorite continuing education course so far.
And so I've done some NKT sessions with you, and what I really appreciate, but what you do is you send like this email afterwards. It's very detailed. It's like, okay, release this, and here's pictures, and here's a video that will tell you how to do it. and then activate this with another video and description. It's like, because I've noticed in my own practice, I will give my patients homework, but oftentimes I don't write it down or I don't send them an email. And the minute they walk out that door, it's gone.
Yeah.
So I really appreciate your follow-up and the detailed instructions. I think that that's a really great thing to do for your patients.
Yeah. You're so welcome. And I'm just kind of nerdy, so I type it all out like that. But one of the things that David Weinstock, who's the creator of NKT, what he recommends and what he does with his patients or clients is he'll actually video them. So he'll video, okay, here's the spot that you need to correct, and he'll do it with their phone, right? So they have it. They have it on their phone, and he'll say, okay, here's the spot that you need to release. And then he'll video them doing the activation, or have them video him doing the activation exercise so they can see it. So he kind of does it on the spot. So I create a little bit more work for myself by doing the email version. But either way, you want to get their homework on their phone, because if you write it down or you give them a piece of paper, a lot of times it's going to get lost and people don't really pay attention to that. But if they have it on their phone, then you really have no excuse. So,
and you showed me a cool trick too on the iPhone, how you can switch it to slow-mo. So you can take slow-mo video of like somebody moving to assess some movement dysfunctions too. So thank you for that tip as well. Yeah. And back to the point you're making earlier about how networking is great to get clients, but it's also good to meet other professionals in the field because we all have specializations. So it's, there's so much that we can learn from each other.
Yeah. Yeah, I love that, because then it creates a referral network for yourself as a practitioner, because there's so many things that work and that are helpful and that help complement what you're doing. And it's nice to know people that do those things.
Yeah. Well, and as healthcare practitioners too, you and I have talked about this, how we're always like looking over the table and bending over and putting putting our bodies through a lot while we're treating people. So we need each other to keep each other healthy as well.
Yes, absolutely. That's another added benefit.
Yeah. And one other thing I wanted to mention about NKT is that there's actually a lot of yoga tune-up teachers that do NKT because a lot of them don't have a license to touch, so they can't actually provide like the manual release work. But with the yoga tune-up balls, they can teach people how to release their tissues using self-massage. So it's a really synergistic modality with a lot of treatment options.
Yeah, I love it.
Yeah, it's pretty fascinating.
Yeah.
It's super confusing, but fascinating.
Absolutely. And that's why I send the email with the pictures and the videos, because that's one of the parts of my job that I love the most is just patient education, because I'm sure you encounter this all the time too, but it's amazing to meet people and they just know nothing about their body, and to us who are in the field, it's like, how do you not know this? But it makes sense if they haven't studied it, but at the same time, it's like, okay, well, let me teach you something, because this is what's going on, and this is how this works, and this is why this is happening. Yeah. And it's cool to see the light bulb go on in people's heads, because I've been lucky enough that pretty much all my patients like that information. They're not like, yeah, just fix me. They're like, oh, this is cool, and they have questions, and they're engaged, and it's fun.
Yeah. And that's like so important for their long-term health too, because it's like, this is a theme that keeps popping up too in my learning. And that is that we don't fix the patients. It's like, we basically just kind of facilitate them to heal themselves. So it's like getting that partnership with the patient and educating them about their body so that they can operate them better is really what gets them to feel better in the long run.
Exactly. Yep.
So earlier in the call, you mentioned that you have a unique approach in a saturated field. So can you explain like what makes your form of chiropractic care? Why should somebody come see you versus another chiropractor?
Yeah. So for one, just in terms of chiropractic services, I provide full body chiropractic care. Mm-hmm. And although every chiropractor gets one course and one course only in extremity adjusting in school, most of them don't feel comfortable doing it because you only get that one course. Meanwhile, we get tons of courses on spinal adjusting. So I actually did a lot of postgraduate coursework to learn how to more thoroughly treat and adjust the extremities. And so legally, I can't say that I specialize in it, but I would say that I focus on it a lot. And so I'll actually get referrals from other chiropractors to help treat the extremities in the patients. So I treat a lot of plantar fasciitis, a lot of carpal tunnel syndrome, shoulder problems, knee problems, hip problems. Even jaw, the TMJ, that's considered an extremity.
Oh.
And so I even do some work with that as well. So I would say I'm a little bit more qualified than some of my other colleagues because I've put in the extra work to learn how to really thoroughly treat those areas.
Mm-hmm.
And I'm also not afraid to address them. You know, a lot of the referrals that I get from other chiropractors are just because they don't feel comfortable. They're like, oh, I don't know what to do with feet. I don't know what to do with wrists. Like, go see her. You know, and I'm happy to collaborate with them too. So in those instances, I'll just treat the person's extremities and then I'll send them back to their chiropractor to do the spinal work. So I would say that sets me apart a little bit, but then honestly, also just the NKT. So there's only one other chiropractor in the Tampa Bay area who does NKT, and I love her. She and I are really great friends and colleagues as well. But she pursued, even though she's certified in neurokinetic therapy, she more so focuses on active release techniques, otherwise known as ART. And so she doesn't really focus on it a whole lot, and she's also just level 1 certified, whereas there's 3 levels in NKT, and I'm level 3 certified. So I get a lot of people, because there's a provider website for neurokinetic therapy, so I get a lot of people actually that find me on the provider site. Since I'm more or less the only person in the area that does it, and definitely the highest certified person in the area that does it, a lot of people come to me for that, which is pretty cool.
That is cool.
Yeah, so I would say that those 2 qualifications set me apart. And then I'm also not a super high volume practice, meaning that my office is not like a revolving door. You know, I'm not like in and out, just kind of crack, 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 get out. I always do with every appointment, even if it's just an adjustment appointment, I'll always do at least a little bit of soft tissue work to just relax the person's muscles before the adjustment. And then I also incorporate some corrective exercise as well. So even my most basic chiropractic, my standard chiropractic appointment is still 15 minutes. And then my neurokinetic therapy appointments, they'll range anywhere from 30 minutes to 60 minutes. And usually the person's also getting an adjustment in addition to that.
Yeah.
So, yeah, I would just say that in general, I practice a lot differently than my colleagues.
Very cool. Okay. So I wanted to just keep this to about half an hour. So anything else that you would, any other advice you'd like to share with somebody who's just starting out, whether it be a new chiropractor, a new massage therapist, anybody in the health and wellness field that's just starting out?
Yeah. So, I mean, the point that I already made, I would definitely recommend getting going with a business coach, just because, like I said, I wasn't paired up with the right person initially, but with my coach now, it's like night and day. And I mean, she has systems in place that I can follow, and it's kind of like, I mean, I can tweak the systems and make them my own within my practice, but more or less it's like, here you go, here's a practice in a box, you know, and just kind of do this system or have this form, here's intake forms, what have you. So I would find a business coach, probably that's ideally also in your same profession. And so it's just kind of, it can ignite your launch a little bit and streamline some things, because I just had a ton of questions. So I still definitely recommend that. I recommend get your business name, whatever you want to call it. Get that registered ASAP, because that can take a little bit of time. And I worked with an attorney to get that set up, but you can also work with an accountant, I believe, in most states. So find one of those 2 professionals and get your business name registered. That's kind of going to be step number 1, more or less. And then get your website going, just get out there and try to meet people and market as soon as possible. And then it'll just kind of be a personal decision that you'll have to weigh as to whether, do I want to keep my overhead low and have to put in more grunt work, or do I want to spend a little bit more money getting a space that's more expensive, but it has a lot of exposure and I won't have to work so hard on the marketing. That'll kind of be a personal decision, as will the business loan versus using your own finances. So I don't want to sway people one way or the other too much with that. Another thing that I did that I didn't mention was I did a Groupon when I was first starting, because I was in my small space. And in retrospect, I wouldn't really recommend that either, because at the time my perspective was, well, you know what? I don't have a lot of money to just spend right now, and I didn't want to pay for marketing. So my mindset was, okay, well, I'll just take a cut as people are coming in the door, because Groupon actually takes, at least for me, I think it varies a little bit with professions, but they take half.
Ugh.
So you're already discounting your services, and then on top of that, they're taking half. And so when I did the math of everything, I mean, they pretty much made me do packages. And so for my highest package, which is what most people purchased, I was literally getting $10 per visit. And that's the first visit, which as a chiropractor, or probably as most therapists, you're doing an assessment and you're putting in a lot of work and you're doing the paperwork. And in retrospect, it just wasn't worth it.
Mm-hmm.
So I wouldn't really recommend doing a Groupon, as tempting as it is.
Yeah.
And also just know your worth, know your worth and stay the course, because when you're fresh out of school, it's kind of easy to feel insecure. Like, well, I don't have as much experience as, Joe Schmo down the street, or I shouldn't really be charging that much. But honestly, a lot of your practice growth is just going to come from being confident and being knowledgeable and kind of walking the talk a little bit, and like I said, meeting other professionals and tapping into their networks. And just try to stay the course, because it can also be discouraging at first when you're first starting up. And I mean, I remember my first couple weeks open, I had nobody on my books. And then even when I got like 10 people on my books, that was busy. Like 10 visits a week was busy for me. But I still felt insecure, like, oh my God, I'm never going to make it. So just try to stay that course and know that it takes time. It's not you. Don't take it personally. It takes time for everybody. And eventually you really will attract your tribe, because I'm not the cheapest chiropractor in town, and I'm not the most experienced chiropractor in town, but I get great patients because I'm attracting those, that are a certain demographic just based on how I practice and what I charge and where I'm located. So take all of that into account as well. Try to hone in on what your target market or your target demographic is, and try to choose your pricing and your practice style and your location based on those things, because it'll really help in building the practice that you want.
Yeah. Man, such great advice. Thank you so much for taking the time to talk to me tonight. I mean, there's so many good nuggets in here, like the importance of having a business coach and marketing, and just like thinking ahead of time. I hadn't really considered that that approach of figuring out what market you want, and then using that to base like everything around that, instead of just like, oh, here's a cheap space that has good visibility, I'll plunk myself here. It's like there's a lot more thought work that needs to go.
There really is. And honestly, that was one of the nuggets that I got from my business coach. And as soon as I switched to this business coach that I have now, my practice, like my revenue and everything, doubled within like 6 weeks or so.
Wow.
So it really can make a difference just having someone there to support you and to basically give you these shortcuts of, oh, do this, do that, because they've already gone through the trials and tribulations and figured out what works and doesn't work. And honestly, systems is key to any business. And that's what I've learned. Whatever field you're in, you just need to develop systems within your practice. And that way, it can make it more easily sellable when you're ready to step away from the practice, because if there's just systems, then anyone can take it over and be like, okay, I just got to follow these systems too. And it also just streamlines things, and it makes it consistent, and it makes it so the business almost runs itself. So that's another key component that I've learned from business coaching as well.
And your business coach, does she specialize in chiropractors?
She does. She does. So, cool. But if there's any chiropractors watching this, go ahead and reach out to me, and I can send you her way.
Yeah. Awesome. All right. Well, thank you so much for taking the time to talk to me tonight, Caitlin.
Yeah, you're so welcome. Thanks for having me. It was fun.
All right. Well, I will see you soon.
Sounds good. Have a good night.
Thanks, you too.
Thanks.
Bye.